I'm Dr. Timothy Wilson. I'm professor and chair of urology and urologic oncology at the John Wayne Cancer Institute. My practice has involved managing and taking care of patients with prostate cancer, urinary bladder cancer, kidney cancer in both men and women, and testicular cancer. We help those patients in figuring out what their risk of having prostate cancer is through physical examination, blood tests, urine tests, and then decide if they might need a biopsy to figure out if they actually have prostate cancer.
When patients come in, we really understand that they may be very scared about their diagnosis, they're fearful of the treatment. So we want to support the patient as a whole when they come here, so they're not so scared when they have to go through their treatment.
We designed the best possible treatment plan to cure the cancer, get the best possible result, and also minimize complications.
One of the things that I've been able to bring to St. John's has been the HIFU program. So high intensity focused ultrasound. This is essentially a lumpectomy done with ultrasound beams for the prostate. So no cutting, no downtime, no hospitalization. And patients that are good candidates can get this therapy and be back, doing what they're doing within a couple days. It's really taken out a lot of the fear that's related to prostate cancer and prostate cancer surgery.
We specialize in robotic surgery for patients with kidney cancer, bladder cancer, and prostate cancer. One of the greatest things about robotic surgery is that the Da Vinci robot has allowed us to do partial nephrectomies, which is removing part of the kidney, and helps make that surgery much more streamlined, much safer, and better outcomes for the patients. We have more specialized treatments and diagnosis that we're using to help these patients that they won't find anywhere else. Some of the things we've been working on here at the John Wayne, especially in urologic oncology, is our Sentinel lymph node program for prostate cancer. So the Sentinel lymph node is the first lymph node that the cancer is supposed to go to. And they've been able to find that for breast and for melanoma, but prostate's sort of been in the background. So that's one of the things that we're working on here, and we're using our research that they used from melanoma to forward the prostate cancer research and finding the sentinel lymph nodes.
We're better doctors now because these technologies and these biomarkers have given us the ability to discriminate between high risk and low risk scenarios. So men that have no risk or low risk of having aggressive cancers are spared all these invasive studies that they'd be subject to years ago.
Clinical trial is the research effort in which we are testing new procedures, interventions, or drugs. The good news about cancer medicine these days is that the progress has been astounding with the introduction of immune agents, and they essentially activate patients' own immune system to fight cancer. We've definitely played a significant role at this institution in development of immunotherapeutics.
I think the other big benefit of patients coming to see us at the John Wayne Cancer Institute is that we really work in a multidisciplinary clinic. So instead of 3 doctors, 3 separate appointments, 3 doctors, 1 appointment.
If I see a patient that has advanced cancer, I can simply walk a few feet away, find my colleague, Dr. Twardowski, and he will see that patient on that same day, even though it was unexpected. It's really a very nimble institute that allows us to mix the science of medicine along with the holistic nature of treating the entire patient. Of men that are diagnosed with prostate cancer, even if it's spread to different organs, it's cured in over 90% of those men.
There's no greater gratification for me than helping somebody negotiate a very tricky terrain where their life and their quality of life is at risk. We all have the same goal of providing the best care.
Whether it be treating their disease or treating their mood or whatever else that comes with it. We all have one goal in mind and how to make that patient's experience the best.